patients with diabetes who can have continuous care without even visiting the hospital. And that is why we have now introduced a new app, the first app for diabetes care in India, called Diahome. If you download Diahome, you will be registered as a patient in ARH, and you will be given treatment from experts or diabetologists from our hospital without you visiting the hospital at all.
I was very happy to see this new venture, Diahome, the Diahome app that they came up with. And especially for people like me who need to be regularly going to Chennai for checkup, we require the care and we need to go back for reviews every 6 months, every year. At this point, where this is a digital revolution, this came as such a boom because I was so happy to be able to speak to her face to face. It was such a comfort for me, and I believe that this app could be the same comfort to fellow type 1 diabetics and diabetics in general, where they can just access and speak to their doctors face to face from their home itself. That I could just speak to somebody on the phone if I didn't know how to use the app, and they were so friendly, and they just directed me, navigated me to know how to use the app. They taught me how to use the app. They taught me how to book my appointment with my doctor. And the best part is that they've tied up with labs in your city, where if you want, they'll order the tests for you and get your blood test done from your home itself. So all your tests, all your lab reports could be delivered to your home from your home. So this app has come as such a revolution, and it has really curtailed, starting from costs to the whole mental scenario of having to go and travel. It cuts down on so many things and makes it so accessible. My doctor is in my phone at my home with me at all times. Thank you so much, ARH. Thank you so much for this app that has really changed the way. Thank you.
Good evening, everyone, and welcome to another edition of the Hindu Wellness Series. Today's webinar on diabetes management during COVID-19 is presented by Diahome and by Dr. A. Ramal Chandran's Diabetes Hospitals. For over a year now, all that we have been hearing about is COVID-19. It has had a far-reaching impact on various aspects of healthcare. In the midst of the pandemic, there is a greater need to focus on non-communicable diseases such as diabetes. To know how we can manage diabetes better during the pandemic, we have a panel of experts who will take us through various aspects of diabetes. On our panel, we have 3 doctors from Dr. A. Ramal Chandran's Diabetes Hospitals. Let me start by introducing them. Professor A. Ramal Chandran, Chairman and Managing Director of ARH, and President of India Diabetes Research Foundation. He and his team have taken up a series of urban and rural epidemiological studies that have led to information on various aspects such as the pathogenesis, risk factors, and temporal changes in the prevalence of diabetes, pre-diabetes, and cardiovascular risk factors in India. The Indian Diabetes Prevention Program, conducted by him, has contributed to the understanding of the primary preventive strategies specifically effective in the Indian population. He has published more than 400 research papers till date and has received several awards, including Best Investigator Award by World India Diabetes Foundation, Healthcare Access Award from Organization of Pharmaceutical Producers of India, and Minarini Award from World Community for Prevention of Diabetes. Dr. Nandita Arun is a director and consultant diabetologist of Dr. A. Ramal Chandran's Diabetes Hospitals. She did her undergraduation in Sri Ramal Chandran Medical College and went on to bag the gold medal in preventive and social medicine. She did her post-graduation in general medicine at Sri Ramal Chandran Medical College. She underwent training for research at the University of Cambridge, training for diabetes at Christian Medical College, and diploma in diabetes from Cardiff University. She has, to her credit, a conferred fellowship by the Royal College of Physicians and fellowship by International Medical Science Academy. Dr. Nandita has several international publications and presentations to her credit. She received the Young Research Achiever Award and also the Outstanding Young Investigator Award from Tanker Foundation. We have with us Dr. Arun Raghavan, Director, Consultant Diabetologist, and Intensivist. He underwent training for research at Yale University. He underwent training for diabetes at Christian Medical College and obtained a diploma in diabetes from Cardiff University. He did his training in critical care at Madras Medical College and at Apollo Hospitals, where he obtained fellowship in critical care medicine. He was conferred fellowship by International Medical Science Academy and also was awarded membership from the Royal College of Physicians. He has received a number of awards, including the Rising Star Award, Global Healthcare Young Professional Award for the year 2021. I once again extend a warm welcome to our panelists and audience. We will now move on to our first speaker. Dr. Ramal Chandran will give us an overview of our diabetes management during the pandemic. Over to you, sir.
Thank you, Sarina. And I also thank the Hindu group for collaborating with us on this webinar on diabetes and COVID. As just now discussed, COVID-19 pandemic has changed all our lives and has given us a new meaning into life. In fact, it has affected everyone, everywhere in the world. Our country had our own share of problems. The healthcare system in our country did take the brunt of the viral pandemic. The pandemic brought out many weaknesses in our health system, mainly the poor infrastructure and the inadequate availability of essentials and inefficient supply chains. Of course, at the height of the pandemic, we did not have enough hospital beds, and even oxygen supply was in demand. But one of the things that brought out was the strength of our health system and the resilience of the system in handling the pandemic. The main strength that we exhibited was our healthcare manpower. Our doctors, nurses, and paramedical staff rose to the occasion. They worked very hard in extremely difficult and challenging conditions and saved many lives. In fact, many even sacrificed their lives to save the life of the people. An important casualty during this pandemic has been the non-COVID medical care. Large number of patients with chronic diseases such as diabetes, hypertension, heart disease, etc., who need regular medical care were and are suffering even today, sitting in their homes due to this pandemic for more than a year. These diseases, especially diabetes, which is a typical example, is also age-related and increases the risk of complications and adverse undesirable outcome in COVID infection. It is estimated that about 80% of deaths during COVID infections, especially in our country, were among people with comorbidities such as diabetes, hypertension, and heart disease. In our own study, which was done in Chennai, we had collected data from about 5 hospitals in Chennai. We all collected 1,000 patients. This is a study done last year during the pandemic among patients hospitalized for COVID infection in Chennai. And we found that the mortality or fatality was twofold higher in diabetes compared to those without diabetes. We also found almost all the complications during the COVID infection was significantly higher among diabetic patients compared to non-diabetic patients. One of the important things which came up was kidney failure was almost 6 times higher in diabetes compared to people without diabetes. However, another factor which came up was that diabetes was not only a risk factor, but also needed aggressive therapy during COVID infection, and about which Dr. Nandita will be talking about. We also found the level of control of diabetes was directly correlated with the adverse outcomes of COVID infections. Therefore, keeping diabetes under good control during the pandemic is of utmost importance. We all know that the prevalence of diabetes is high in our population, especially compared to the Western population. And we also know that about 50% of the people with diabetes do not know that they have diabetes. On top of this, we also found a new emergence of a new form of diabetes due to COVID infections. And Dr. Nandita will be talking about diabetes and COVID in detail. Of course, the drug therapy for diabetes need to be modified during the COVID infections, during hospitalization, and even after the COVID infection is completely resolved. Today, we find that many suffer from post-COVID sequel or syndrome after recovering from COVID. We are still in a learning stage of this aspect of this illness. This can range from simple psychological problems and depression to extreme physical illness involving even neurological conditions. At the same time, we also found diabetes goes very much out of control during the post-COVID period, and definitely they need modification and change of diabetes drugs or more up titration and aggressive therapy during the post-COVID times. And as I said, Dr. Nandita will be elaborating on this aspect. A very common question that is frequently asked now is regarding vaccination, whether people with diabetes can go for vaccinations. The answer is definitely yes. In fact, it is recommended that you take the vaccination as early as possible if you're a diabetic and if you have any associated conditions such as high blood pressure, a heart disease, you already had a bypass surgery, etc., because these conditions make you or give you higher risk of getting complications during COVID infections. Now, generally speaking, diabetes is a chronic disorder, and most of the patients are actually asymptomatic, and one will feel healthy even if the blood sugar is not under control. A very deceptive sense of well-being. But it is important to keep sugar under control along with optimized control of your blood pressure, cholesterol, and body weight as well. This makes it mandatory to have regular medical checkup at periodical intervals and consultation with your doctor. Once in a year, we should have a comprehensive check, including heart, eyes, nerves, etc., in order to prevent long-term complications of diabetes. Even in the non-COVID times or pre-COVID times, elderly people, especially people with diabetes, and I'm talking about diabetes because diabetes is age-related. Many elderly people find it difficult to go for regular visits due to many problems of visiting a hospital and the time that you have to spend for going to the hospital and the time that you spend in the hospital. And many of them, being elderly, have to depend on their sons or daughters or somebody young in the family to accompany them to the hospital. It is often they find it difficult and they will not have time because they are all working. These difficulties make them drop out of the routine care. And this is a very common thing that we have been seeing for the last 2 decades. This makes them vulnerable to complications, and often they end up in medical emergencies with acute medical events. The COVID situation presently has worsened this particular situation. The scenario is much more critical. The fear of exposure to COVID and the lockdown rules have made it almost impossible to go for routine checkup. Understandably, the priorities have changed both for the families of the patients as well as the medical side itself. Thousands of people with diabetes are not able to seek routine diabetes check as the hospitals and doctors are busy with the pandemic. Nobody wants to get exposed to the hospital environment today, and even a long wait or a few hours of wait in the hospital to see expert doctor is absolutely not desirable. Therefore, we have now come out with a solution. All of us are already familiar with the use of the internet for buying provisions and ordering delivery of food at home and even getting a service such as a haircut. Our new plan is to deliver a total diabetes care at your doorstep. We have developed a unique medical mobile app called Diahome, and you can see that logo behind me in the virtual background. This app can be downloaded in your mobile phone like any other app that usually you do. Once you download the app and register, we will arrange the blood check and video consultation with expert diabetes specialist sitting in the comfort of your home anywhere in India at a very affordable price. Dr. Arun will give full details of this diabetes telemedicine program, and the details can be discussed. We believe that this app will help lakhs of people with diabetes to receive expert diabetes care at home without getting out of their homes at all. And Dr. Arun will be giving an elaborate description of this new medical app for diabetes called Diahome. Thank you.
Thank you, Doctor, for giving us an overview of the entire spectrum. And I'm sure your insights will be of help for the audience. We keep hearing from doctors on how important it is to keep comorbidities checked to prevent complications. Dr. Nandita will elaborate on various aspects of diabetes management during the pandemic, including keeping diabetes under control to prevent complications, its treatment, and post-COVID sequelae. Over to you, Dr. Nandita.
Thank you, Serena. Very good evening to everyone present here, and special thanks to the Hindu for collaborating with us this evening. And thank you everyone for signing in, taking your time and signing in. I hope everyone is doing well and safe. I'll just take a second to share my slide. I think you just got a glimpse of my speech there for a second, but before. Right, so is my first slide visible, Serena?
Yes, it is.
Yes.
Right, great. So yes, as the pulse of this meeting has actually been set by Professor Ramal Chandran very nicely. He discussed about how the COVID pandemic has literally changed our lives. The pandemic has literally taken us all by storm. And we have learned a lot of things. It has taught us a lot of lessons. But from the medical point of view, I think one of the most important things that we have come to learn, and the most important factor, is that it has further reinforced the importance of blood glucose control and the importance of keeping your blood glucose on check for patients with diabetes, especially to improve your immunity levels. We all know, and we heard even from the previous discussion, that there are various risk factors which increase the risk of complications due to COVID infection. The manifestation of COVID infection has been very, very varied, and it's taken us by surprise with every new case that we see. But one common factor that we found is that those with comorbidities, which include diabetes, hypertension, obesity, cardiovascular risk factors, these are the patients who are at higher risk of both the complications of COVID infection and also higher rates of death as well. So as we heard from the previous discussion, we actually conducted a study, and from this particular analysis, we also came to know that the higher your HbA1c, and for the benefit of those, I'm sure many of you do know what the HbA1c is, but for those who do not know, the HbA1c indicates how your blood glucose has been over the prior 3 months before testing, right? So what we found from our analysis and from the studies that we conducted and the papers that we have published is that for those who had a higher HbA1c at baseline or at COVID infection, the risk of complications actually started increasing much higher. So when we divided patients to a HbA1c less than 7 and those with a HbA1c more than 8 or uncontrolled diabetes, usually a good HbA1c is less than 7. So those with a HbA1c more than 8, which indicates poor glycemic or poor glucose control, the risk of complications, which includes the lung complications, the heart complications, the kidney complications, and also death rates, just jumped up sky high. And so it was, we concluded from that the higher the HbA1c increased, the higher the risk of complications and death due to COVID infection. So what we can conclude from this analysis is that it is extremely important to keep your blood glucose under check, to improve your immunity, and to have the capacity to fight this COVID infection or any infection for that matter, but particularly during this pandemic, it is extremely important to keep your blood glucose under control, and in other words, keep your HbA1c under control as far as possible. Now, there are very many challenges that patients face, and even clinicians or doctors face when it comes to treating patients with diabetes and COVID infection. Some of these, most important, is that the blood glucose tends to shoot up once there is a COVID infection. There are some reasons for this. The first most important is that the virus or the infection itself and the stress that the infection causes itself can increase the blood glucose. And this is what is called stress hyperglycemia, or the inflammation, or the so-called cytokine storm. I'm sure many of you have heard or come across in literature. This inflammation or the whole stress that the body is put through during an acute COVID infection itself can increase the blood glucose levels. Number two, the various treatment modalities, the various drugs that are used, including especially the steroid therapy, which is a life-saving drug in patients with severe or even moderate to severe COVID infection where they have lung involvement. Steroids are literally lifesavers, and it has to be administered. And when we administer steroid therapy to patients with COVID infection and those with pre-existing or in patients with diabetes, the blood sugar again shoots up very, very high, because the steroid is what we call a counter-regulatory hormone that increases blood glucose levels. So these are factors which increase blood glucose levels. Now, beyond this, there are other challenges that patients face. There are patients who get a lot of vomiting, they have diarrhea. These are very common symptoms due to COVID infection. There are patients who have loss of appetite and are unable to eat very well, loss of taste, of course, loss of smell. These are all challenges that patients face during the COVID infection, and this becomes a challenge especially for people with diabetes. Now, what happens is, because of these particular situations that patients are faced with, we do have to have certain modifications in their routine diabetic medicines. And these modifications, of course, I'm not going to go into too much details of it because it will be too medical for the sake of the audience. I'll just sort of give you a gist of it. There are certain drugs which may not be and may not suit patients during an acute crisis or during an acute infection like vomiting or whatever, sepsis or whatever the infection may be. And these drugs may have to be withheld. Secondly, patients may also require shifting over or transition to insulin therapy. And this insulin may be temporary, which may gradually then be withdrawn later on once there is recovery. So these modifications in therapy and initiation of insulin, all these require expert care from your diabetologist. And many patients who are in home isolation, many patients who are not admitted and who are at home, do not have access to their diabetologist, to their clinic, to their doctor who's treating their diabetes. And that is where Diahome comes in hand, because this is an app that connects the patient very easily. And we are still treating a lot of patients with COVID and diabetes and helping them out at this particular time. The next aspect, of course, is that even in patients who were previously non-diabetic, there are new entities of hyperglycemia or new manifestations of high glucose that we find in some patients when there is COVID infection. The first one was the stress-induced hyperglycemia, which I was talking about just a few minutes ago. But the other new type is the new onset diabetes. And this is something very, very peculiar, one of its kind that we are just seeing, in which what happens is the virus, which is the COVID-19 virus, attacks the pancreas, and in fact, the beta cells, which are the cells that release the insulin hormone, which is responsible for blood glucose control, is actually attacked. And because of this infection of the beta cells, there is a deterioration in the pancreatic function, or the so-called endocrine pancreatic function. And as a result, because of this, these patients develop what is called a new onset diabetes, which is a very peculiar type of diabetes, which may be autoimmune, which means that patients may require insulin. And we are yet to know, to find out a lot more about this new onset diabetes. Beyond this, now we are in a particular, moving on to a phase where the number of new COVID infections is coming down. However, a lot of patients who do recover from COVID infection are still not completely recovered because of the so-called long COVID or the post-COVID syndrome or the post-COVID sequelae. Now, this is a particular scenario in which patients, even after the virus has come and gone, the acute infective phase has actually gone, and the virus is out of your system. And yet, patients still struggle because they have a lot of difficult symptoms to deal with, and some of them can range from tiredness, severe lethargy, severe body pain, muscle and joint pains. Many of them still have cough, and due to this, they also have shortness of breath. They're not able to climb even a set of stairs. A lot of people even have disturbed sleep. Some of them even complain of hair loss. And beyond all this, the most troubling aspect is the psychological aspect that comes with the post-COVID, in which patients go into also a severe depression, anxiety, and even a sort of a brain fog, which is what we've come across, where patients are not able to think very clearly, and they definitely do need some help. So this scenario in which patients go into this long COVID can last once the infection is completely, if the acute phase has come and gone. This long COVID can actually last for 1 month, 2 months, 1 week, or even as long as up to even 6 months, which is what we found even in the previous wave. And even in this second wave, we find a lot of patients who suffer from this pain and this body pain. So there are factors to keep in mind for those patients who are suffering from this long COVID or the post-COVID sequelae, or those people that we know. There are certain recommendations for this post-COVID-19. The most important for those people with diabetes is to keep your blood glucose under check, because even after recovery from COVID, and even after you discontinue your COVID medication, there is a certain period of time where during the recovery period, patients do still struggle to bring their blood glucose under control, because the stress that the body has been put through takes some time to settle down. So and many patients who have been initiated on insulin during the acute phase of infection and just out of the hospital or even at home, in the post-COVID phase, stabilizing your blood glucose and that transition from insulin to your older therapy or your older medication and bringing it back to baseline and controlling your blood glucose must be very delicately handled. At the same time, patients also, because of their loss of taste, loss of appetite, it is extremely important to get a good diet plan and consult your dietitian, eat a good, nutritious, healthy diet. Make sure you get a good amount of protein and fiber with nutritious food, fruits and vegetables, and maybe nuts if you can include that in your diet as well. At the same time, when it comes to resuming exercise, there's a lot of factors that need to be taken into account, because patients who in the post-COVID phase, sometimes because of the breathing difficulty and the cough that persists in the post-COVID time, it is very, very important to take it one step at a time. Do not try to go back to your pre-COVID exercise regime where your intensity of exercise and your stamina was very good. It may take some time where you take tiny steps, and that goes a long way until you can can actually reach your pre-COVID capacity for exercise. So it is very important to take all these factors into consideration. And then last but not the least, also psychological counseling for those who do require help in psychological counseling. Please do reach out to your, do not feel afraid to reach out to a counselor to help you with your psychological status as well. And family support from your friends is extremely important. So Diahome has actually brought together all these aspects, and post-COVID rehabilitation is something that we are also specialized in. Of course, I would like to end on a positive note that the only solution that we have at this point of time is the vaccine. And for those of you who are not yet vaccinated, please do go ahead and get yourself vaccinated. For any further doubts, I think in the next talk, Dr. Arun will be elaborating further on that. Thank you.
Thank you, Doctor, for highlighting in detail the various risk factors, challenges in patients with COVID, long COVID, and your list of post-COVID recommendations. COVID-19 has definitely broadened the scope for technology in healthcare, more so in taking healthcare to the homes of patients, especially at a time when our cities have gone under lockdowns. Dr. Arun will now take us through the features of Diahome, an app which leverages technology to deliver comprehensive diabetes care to one's home. Over to you, Dr. Arun.
Thank you, Sarina. Let me start sharing my screen. One second. Thank you, Sarina. At the outset, I would also like to thank the Hindu for hosting this webinar. So I'm going to start off with a very important message for all of you who are not vaccinated yet. I urge you to vaccinate. As we know, the pandemic has had a catastrophic impact on our country, on our healthcare infrastructure, and also a grave impact on the economy. The only way that we will be able to mitigate the spread of infections, also preclude the possibility of a third wave, is only with vaccination. So the government as well as the healthcare bodies have been quite explicit about the importance of the vaccination. Now it's up to us, the community, to step in and make this vaccination drive a successful one to overcome and win against this pandemic. We've known, like Professor Ramal Chandran said, there's been a lot of myths and a lot of fears that have been circulating on social media as well as from hearsay information. Some of the concerns that patients have is if they are on antiplatelets, anticoagulants, should they stop before vaccination? This is some information, this is some questions that we've been constantly faced with. And the other concern is that whether you need to investigate for CRP or do other blood work prior to vaccination. Please understand, there is no requirement of stopping any medicine that the patient is on, who he or she is taking for any comorbidity, and there is no recommended blood workup prior to vaccination. So you can safely go and get vaccinated. Being a diabetologist, one of the commonest things that I face even today, I had a middle-aged woman who came and said, "Doctor, I'm a diabetic. Can I vaccinate?" And again, please do understand, patients, people with diabetes, hypertension, or other comorbidities are the high-risk group who should get vaccinated at the earliest. So with this message, let me move on. So we are at the crossroads of two pandemics. We have diabetes on one side and we have COVID on the other. And India seems to be having the dubious distinction of not just the diabetes capital of the world, but also seems to be propelling the current COVID pandemic. We've seen staggering numbers in the recent past and also some emerging new strains that have been quite concerning. So diabetes, as we all know, is a non-contagious, very passive chronic disorder. And COVID on the other side is a highly contagious acute illness and something which is gripped us all and which grappled us all with fear. So we press the panic button once we hear COVID. Do we give the same kind of attention to diabetes? No. We take it far more lightly, far more easily. But should diabetes be approached that lightly? Definitely not. We know, as Dr. Nandita also elaborated, there is a bidirectional relationship even with COVID. Patients with uncontrolled blood sugars have not only a higher risk of contracting infection, they also have a higher chance of developing more serious infections and complications. That makes obvious reasons that we need to keep the blood sugars under control. And as again Anita pointed out, COVID itself can precipitate new onset diabetes and worsen pre-existing diabetes. Now, this is not very exclusive to COVID alone. Uncontrolled blood sugars can increase the risk of contracting many other infections such as pneumonia, urinary tract infections, foot infections, so on and so forth. So it is imperative to keep the blood sugar under control to prevent infections and also to prevent long-term complications. Unfortunately, we've been seeing that the behavior of patients since the chronic care disorder, they tend to postpone, they tend to avoid seeking help. And there is a different kind of patients. Since we have large number of patients, there are different behaviors. And the pandemic has only made things worse because now the patients are not neglecting care, they are not seeking support for their chronic conditions, which is actually making things worse. Let me draw some comparisons again with the COVID as well as diabetes. As you can see from this illustration, patients who are asymptomatic COVID disease, they are actually not a threat for themselves, but they could be actually infecting other people around them who could start developing probably an illness which could be symptomatic to even a severe illness. So that's why it's such a concern, and that's why lockdowns seem to help, because however good your screening protocols are, be it in the malls, airport, etc., it's still not foolproof. Patients who could be having mild symptoms, patients who could be asymptomatic could be easily missed, and they are actually potential threats for other people who they could easily infect. On the other hand, asymptomatic diabetic patients seem to have different ramifications. Now, asymptomatic diabetic patient can be completely without any illness in the journey of diabetes. But after many years, the asymptomatic patient could actually harm him or herself. He has the risk of developing cardiovascular complications. He has the risk of developing renal complications, so on and so forth. So that's why it is extremely pertinent to keep the blood sugars under continuous control in order to prevent such complications. So it's easier said than done. So the uncontrolled blood sugar is actually the real elephant in the room. So that's where our attention should be. As we know, many of the guidelines have recommended, have proclaimed that you need to check your blood sugar every 3 months. And it is a huge challenge. Think about a patient who's diagnosed at 35 to 40 years. Today, we are getting patients who are diagnosed much earlier. The mean onset of age is much earlier in India, even compared to the Caucasian population. So if they have to continue to screen blood sugars at every 3 months, it is a huge challenge. So that's probably some of the concerns that we've been seeing with our patient over the years. And we felt that there should be a change in the way that we may be able to connect to patients and vice versa. So this is one of the challenges that patients face every day, every other time. We know that they have to depend on their family member, the near and dear. They have to depend on a relative or a friend to take them to a hospital. They have to organize for travel, and then they have to sit in a healthcare environment for hours together, not only for their blood investigations, also meeting the doctor. So these are challenges that the patients are burdened with at every interval. So this has to be largely overcome in order to establish continuous blood sugar control for patients and finally prevent them from complications. So on that note, as digital healthcare could possibly revolutionize chronic care conditions such as diabetes, hypertension, and dyslipidemia, we've seen that there has been an explosion of digital healthcare in the recent past, particularly during the time of the pandemic, from the time that the first wave has begun. But to understand where the digital healthcare can really play a major role would be actually in medical diseases such as diabetes, such as dyslipidemia and hypertension. I think this will be a game changer, and patients can now connect with their doctors through digital mediums and make sure their disorder is taken care of. On that note, we wanted to bring this digital solution for our patients at the same time without compromising the comprehensive diabetes care that we've been providing over the years. And that's how we launched Diahome. The advantage of Diahome is it gives you 360-degree comprehensive diabetes care. We made sure there is no compromise, and patients can now, at a touch of a button, connect with the doctor. There is no waiting time, and each patient has the advantage, can access the laboratory, can access the pharmacy. Everything is delivered at the patient's home step. And most importantly, which is exclusive to Diahome, is that we built a very unique investigation team with different skill sets, where not only the basic blood workup, but patient's height, patient's weight, patient's waist circumference, as well as blood pressure, if required, ECG, nerve conduction studies, Doppler biothermometry, and all of this can be done at a patient's home itself without the need to travel, without the need of waiting in queue for each of these tests at the hospital. So that's the advantage that Diahome brings into patient's life. And it has a complete holistic integrated care. Now, diabetologists work in tandem with the nutritionist as well as the diabetes educator. They all work in synchrony. And the advantage of Diahome is we offer completely free of cost nutrition and diabetes education advice throughout. We also have free healthcare assistance support, which is offered completely free of cost for the patients. And then patients also have the advantage of access to electronic medical records. And as I mentioned, also can get the drugs delivered home. So all of this at a touch of a button. Diahome is the diabetes care partner for every diabetic patient. With that, I think I have also given a short 1-minute video, which can be played right now. Yeah. If you can play that video. Thank you.
Thank you, doctor, for taking us through the importance of blood sugar control and for explaining in detail the features and advantages of Diahome. We will now have a short AV on the various features of Diahome.
Did you know that diabetes is India's fastest growing disease? But during the pandemic, how can patients travel to meet their doctors? How can they keep diabetes in check? And how can you take care of your family members? The answer is Diahome, a digital initiative by Dr. Ramal Chandran's Diabetes Hospitals. Diahome is an expert diabetes care experience from the comfort of your home. Simply open the app to register yourself and family members and book consultations with doctors, review your appointments and order medicines from home. A physician assistant will be your point of guidance. You can also order multiple tests from one place. A collection executive comes to your doorsteps to collect the necessary medical details. No more time wasted traveling and booking consultations. Diahome brings safe diabetes treatment to you. Download the app today.
We will now move on to the Q&A session. I would like to start off by asking a very specific question to Professor Ramal Chandran. So we know that early diagnosis is very important in COVID. And what would be your advice for persons with chronic diseases like diabetes?
I think that's a good question. Exactly, that's what we were telling, that the level of your blood sugar or the hyperglycemia determines or decides the outcome if you get COVID infection or if you contract COVID infections. On the other hand, diabetes per se does not make you at a higher risk of either getting the or contracting COVID infection or even having undesirable or adverse outcomes in COVID infections. So if your diabetes is under good control, you are as good as a normal person without diabetes. So therefore, it is essential, incredibly important, very important, that during this pandemic, please do not neglect your diabetes. Keep it under good control. And that really protects you from the COVID pandemic, whether you are going to get contracting the disease, even if you get the disease, even if you're hospitalized for the disease, if your diabetes is under control, you are at least protected from the very serious eventualities that can occur from COVID infection.
Thank you, sir. I know you touched upon the importance of vaccination, but are there any common doubts or misconceptions that people with diabetes come to you regarding vaccinations, sir?
Of course. In fact, almost 25% of the questions that we are now getting on the telephone and also on the Diahome, the last question they ask before they log off is whether they can go for vaccination. Because people with diabetes are worried about a lot of media reports on getting strokes, complications due to vaccinations. Now, one of the things I have to tell you here is the risk of any eventuality of vaccination, like what they were talking about, the COVID shield, you get cardiovascular events, is much lower compared to the risk of somebody with diabetes and hypertension and heart disease getting COVID infection, and then you can go for complications. So the risk of getting complications due to COVID is much higher, 100 times higher than getting an untoward effect from a vaccination. The second part of the answer would be that if you're a diabetic, it is all the more reason that you should vaccinate as early as possible, especially because most of the people with diabetes are about 65, and secondly, often you're also having associated conditions like hypertension, you have also, some heart disease, or you already had a bypass surgery, or you already had a myocardial infarction or angioplasty, and also if you had any kidney problems, etc. Therefore, it's all the more reason people with diabetes should not hesitate to get vaccinated. It can save your life. So please go and get vaccinated.
Thank you, sir. Dr. Nandita, there are a couple of questions on mucormycosis. So people want to know the link between diabetes and mucormycosis and what symptoms and how they can prevent it.
Right. Yeah, that's a very relevant question, considering that as we speak, there are a number of cases, and this is a recent surge in the cases of this so-called black fungus or mucormycosis that we've seen. And first of all, what we need to understand is that this particular black fungus, or mucor as we call it, is not something new. It's something that has been around for many years, and usually it is generally present in the air that we breathe itself. It usually infects people in whom there is a low immunity. And so it is generally called as an opportunistic infection, where it takes an opportunity to infect a person with low immunity. So when does this low immunity arise? Generally, you find it in patients with, again, very high uncontrolled blood glucose levels. And on top of that, in diabetic patients with very high blood glucose, when we also administer steroid therapy, which is invariably most of these patients do require steroids for recovery. And both put together, this high dose of prolonged steroid therapy, along with high uncontrolled blood glucose, and the immunity, sometimes the steroid itself can suppress the immunity, and along with the high glucose can suppress the immunity with the infection. And for many patients, even in the post-COVID phase, that is when this opportunistic infection of mucormycosis comes in. Now, why is this becoming so important? Is because this mucor or black fungus, once it starts to spread, it spreads very rapidly, number one. Number two, mortality rates, that is death rates, are quite high. So the early symptoms, as you were asking to pick up with mucor, is usually symptoms like a mild headache. It could also start off with, but I don't want to just alarm people, because headache could also be part of the post-COVID itself. But headache with swelling in a part of the eye or a blackening, it's usually in the ENT or the ear, nose, throat areas, so, or involving the eye. And if it starts to spread, then it can spread anywhere in that area. So early picking, diagnosis and treatment is key. And then, of course, what I need to again stress before I conclude is that you need to keep your blood glucose under check to prevent this condition.
Thank you, Doctor. Dr. Arun, there are a couple of questions on Diahome as such. Some of the participants want to know if it's available in Chennai suburbs and in districts like Vellore.
Yeah, the app is available on both Play Store and iOS, and we are right now currently servicing across the country. Not just in Chennai and Tamil Nadu, we are actually servicing across the country. Absolutely, yes, it is indeed available everywhere.
Okay, thank you. There is a question from a participant. He's not a diabetic prior to COVID, but after COVID, he was affected with diabetes, and his fasting blood sugar level is 324. And after 9 days, he is taking glucomet. So he says it has reduced now and needs your advice.
Best advice would be to download the app right now, and we will give him a comprehensive advice, because this also requires not just in terms of the drug, there has to be a balance in terms of his lifestyle, in the diet that he has to take. So everything has to be in a correct proportion. So the best would be to actually download the app, and straight away we are here to support him.
Thank you so much. Professor Ramal Chandran, a participant says that he is a diabetic patient with hypertension, high cholesterol, and he used to walk every day. Now with the lockdown, he is unable to take a regular walk. So in this situation, what else can he do?
Yeah, there are many exercises you can do at home. Of course, if you're one of the easy answers is if you know yoga, you can do yoga at home. Or if you're able to walk in your terrace, you can walk. It is not necessary that you have to walk always in the park or on the road. You can always walk in places wherever it is available. And many of my patients are walking in the terraces of their flats or in their houses. Or if you do not have any space at all, then the only thing is you can do some exercises for your body in your room if you can do yoga. And these practices are now available online on the YouTube. You can ask them to do what type of exercise you can do in a room. It's very easy to do that. Serena is gone. I think she's just off.
Yeah, I think we...
She had a power cut, I think.
Yeah, looks like it.
Okay.
We have access to the questions in the chat box.
Yeah, you had a power cut. Serena, you're back?
Serena's back, yeah.
You're on mute.
I'm sorry, I have power cut at home.
Yeah, I knew. I thought you had a power cut. It's India.
Yes, sir.
I think I must stress the fact that Diahome is available throughout the country. Anywhere in India, people can download Diahome.
Yes, we can hear you.
Get anywhere in India, they can get service through Diahome. It is not only in Chennai, not only in Tamil Nadu, but anywhere in India, Diahome can service, and you can receive diabetes expert treatment sitting in your home, whether you're in Assam or in Calcutta or in Bombay, and we have reached the whole country. Hi, Serena. You're still not back.
Thank you, sir.
Yeah. Your video is stuck.
Am I audible?
Yes.
Yes.
Okay. I'm sorry for the interruption. There's a question from a participant on whether Indian system of medicines could help in keeping diabetes under control.
You want me to answer that?
Sure.
I think there is a big controversy, and it's all in the media going on with Baba Rajiv Singh and the Indian Medical Association. And I don't want to step into that. But as far as diabetes is concerned, unfortunately, 1,000 or 2,000 types of herbs have been tried to actually see whether you can stop the allopathic medicines and give treatment with those herbs. But unfortunately, none of these have proved to be even 1/10 or even 100th efficient as the allopathic medicines that we have. Now, a lot of research and development work has gone into every agent that being produced in the allopathic medicine. And it's unfortunate that we do not have. Of course, I really appreciate and also respect the Indian ancient medicines like Ayurveda as well as homeopathy, etc. They have their own role. For example, Ayurveda can be still used for patients who have chronic illnesses, like if somebody is getting out of recovering from a stroke, he can go for physiotherapy and massage with Ayurveda. But it's unfortunate that diseases like diabetes, hypertension, heart disease, we have to depend on allopathy today. And I don't think none of the native medicines have any role to play in the treatment of these conditions.
Thank you, sir. Routine health checkups have taken a hit during the pandemic. So one participant wants to know if it's done so that their diabetes can be diagnosed early. Dr. Arun, would you like to take the question, sir?
Yeah, sure. Sorry, I didn't hear the whole question. I heard it in parts. So you were saying routine investigations?
Okay. Routine health checkups during the pandemic. Is it safe to go for routine health checkup during the pandemic?
Yeah, so yeah, routine health checkups can be possibly avoided. So that's where, you know, the digital entities play a pivotal role. So you could now pretty much most of the laboratories also are available where they come home and collect your blood, and then they give you the investigations either online or through email. So you know, that's something that patients can right now get easily done. So in terms of, as I mentioned, for diabetes comprehensive care, we have an application where apart from blood workup, we are able to do a complete list, holistic investigations, including, as I elaborated earlier. But having said so, if the patient has any symptom of or any other illness, it is good to seek healthcare support, go visit a hospital without neglecting any symptom of any illness. Otherwise, routine preventive or for screening or regular, patient can actually opt sitting at home. I think your bandwidth is low.
Are you there, Serena? I think your
bandwidth is low.
Video is stuck.
I think maybe you can switch off the video and talk.
They reinforce what Arun said. Patients who wants to have a routine checkup and want to avoid going for a routine checkup to check whether they have diabetes, one of the best ways is actually just download the Diahome, and then you can get your blood test done and the routine checkup done at home without visiting the hospital and having the risk of getting exposed to the hospital environment, where definitely you have the risk of contracting COVID infections. So therefore, routine care can be now done at your home. And that is exactly the thing that we're talking about, that the applicability of Diahome is very, very wide. Yes, Serena, are you back? Not yet.
Yes, till she is back, I think.
There's a question from a counselor.
Okay. Go ahead.
We can't hear you.
Yes.
I think somebody else can step in. I think somebody else is
Sorry for
coming
the
forward.
interruption.
Anybody else can ask?
I'm providing counseling to COVID patients, and some of them have diabetes.
Oh, okay, counseling.
Can you hear me now?
I think I can see the question. I'll read it out, Serena, because I think we're not able to hear you very well. No. The question is from a person who's a counselor. It says, respected sir or ma'am, I am providing counseling to COVID patients. Some of them were having diabetes. What health measures can I give them for maintaining good health? This is from a person, Nanda, who is a counselor. So, you want to take it? Hello?
Yeah. I don't, counseling can be done to Diahome.
Yeah,
He
so we
cannot.
have counseling also part of Diahome, absolutely. So I think we have to again approach individual by individual. So it depends upon what the concern for every individual is. The individual could be still be having a fear of COVID itself, or maybe some other symptom that which is persisting. Some patients could be still having the impact of steroids and sugars could be high. Some people could still be having cough. I've had patients where they keep checking saturation even after completely recovering, so they don't get the pulse oximeter off their room. So I mean, these are various patients come with the various kind of fears. So I think we have to approach it on an individual basis. And I think obviously the counseling plays a very, very important role, and we have to only address it as case by case scenario.
I'm actually looking at the question box, and there's a question on metformin. Will metformin affect the kidneys, and what is the maximum dose per day? Metformin, so I think I'll take that question. Metformin is a basic anti-diabetic drug, and it's a very pertinent, very important question. Thank you for asking that. I'll very quickly summarize. So metformin is one of, like old is gold, one of the oldest, safest, most effective drugs for type 2 diabetes that makes your natural insulin in the body work better. It does not cause kidney damage or kidney failure. It is very, very safe. However, in patients who do have kidney impairment or those who go in for impaired kidney function, the excretion of the particular drug, for that matter, most drugs do require are actually compromised because the kidneys are not able to excrete it or flush it out of the body as effectively. And as a result, your dose of metformin will have to be adjusted according to the kidney function. Now, there's also a belief that metformin may cause what is called acidosis or lactic acidosis, and it should be avoided in patients with renal compromise or kidney compromise. But this is extremely rare. And as I said, metformin is one of the safest and the oldest drugs. The maximum dose usually that we start off with is usually we start with around 500 milligrams a day, and you can even go up to 2 grams per day. It has many other benefits other than just controlling the blood glucose, but I think we're running out of time.
Arvind is there? Who is there to replace Sarina?
Yeah, we can read out, sir. Yeah, there are a couple of more questions on the plans and costs that are available on Diahome app.
Oh, plans. I don't, you want to just take it up and...
Yeah, at this point in time, we are offering everything at a very, very, very affordable cost. So there is no charge for downloading the app. The app is completely free of cost. All the investigations that are done at patient's home, including the entire bandwidth, entire spectrum of investigations, are at a very, very compelling cost, which is probably the lowest in the market. There is at this point in time no subscription cost, no premium cost. It's a very, very affordable, complete bandwidth of services offered at a very, very affordable rate.
There's also one interesting question. I think this question is there in most of our minds as well. I'm working in a government organization. I have medical bill reimbursement for my employer on production of bills, subscription from doctors, and consultation fee from doctors. If I use Diahome, is receipts and bills are provided?
Not yet. So at this point in time, it's still an evolving ecosystem. I'm sure in the future, there will be obviously there will be empanelments and recognition by the insurance players. There are certain corporates which have come forward, are now reimbursing for their staff, particularly the multinational corporates. But at this point in time, both the private as well as the national insurance providers have not tied up with any of the digital healthcare service providers. But in due course, it will happen.
Thank you, Doctor. There's one question from Mr. Gopal B. What is the importance of adhering to the daily timing of the diabetic medications as well as the medication time vis-a-vis food? Example, 30 minutes before breakfast versus medicine after FPPD.
Nandita can answer. Nandita.
Sure. So many of the anti-diabetic medicines, when I'll talk about the oral tablets and of course insulin for that matter, do need to be timed with your food as far as possible, because the peak of your blood glucose is usually post-meal, 1.5 to 2 hours. And the onset of action of your oral tablets, which release the insulin into your circulation and sort of handle that peak in the blood glucose or take care of that blood peak, should actually coincide. So taking your tablets as prescribed by your physician, usually for certain groups of drugs, we say half an hour before the first bite of your meal. And even with insulins, we say half an hour before, or the newer insulins, we say just before your meal. The main reason for this is because we want it, like I said, to coincide with your post-meal peak. And so it's important. There are certain other drugs, of course, which can be taken even at bedtime. It depends on from medication to medication. And of course, it's most important to individualize therapy. That is where your doctor's advice and to get specialist expert care is extremely important. And yeah, we are here at Diahome to help you with that.
I'm extremely sorry for the unscheduled power cut and disruption in internet. I'm sorry. So many of them want to know about the new onset diabetes in the post-COVID period. So what would be your advice? And are you seeing a number of such cases?
I can answer that because when somebody is getting admitted with COVID infection or coming to hospital, there are three scenarios when the new diabetes comes. First is somebody who had already had diabetes and was undetected, because 30 to 40% of people with diabetes are undiagnosed at a given time under their test. So when they come with a COVID infection, suddenly you find you have a high blood sugar and probably you are having diabetes for some few months or even a couple of years. The second thing is there are people who are pre-diabetic. They're not yet diabetic, but they're having a blood sugar which is higher than normal. We call it impaired glucose tolerance or pre-diabetes. Those people who get COVID infection, because of the COVID infection stress, which Dr. Nanda explained, the diabetes get unmasked. There'll be conversion of pre-diabetes to diabetes. The third scenario is one just now watched, and that is called the new onset diabetes, where the patient did not have any diabetes, did not have even the susceptibility or a family history of diabetes, but because of the COVID infection, we have found they get into florid diabetes suddenly. This is something like typical of what is called type 1 juvenile diabetes, which happens in children because of a viral infection. So this is a very new entity, so far not described in the medical textbooks or in the medical literature. The mechanisms are being actually worked out, but we know that the COVID virus infection has special affinity to certain receptors, and these receptors are also present in the beta cells of the pancreas, which produce insulin. So it can kill the insulin-producing cells. Secondly, virus infection can also trigger what is called an autoimmune reaction. And that is because they produce cytoplasmic antibodies, which will act against the beta cells of the pancreas. Of course, there's something called cytokine storm, which was described earlier, that can also actually injure the beta cells. So there are several mechanisms why it looks as if COVID infection is actually attacking the insulin-producing cells in the body. And this new onset diabetes is coming into light as a new form of diabetes. So another viral infection producing what is called autoimmune type 1 diabetes in patients who get COVID infection. Of course, whether it is new infection or you have to treat the blood glucose aggressively, whether it is new diabetes or old diabetes, it doesn't matter. High blood sugar is detrimental for the complication of COVID infection. So you've got to treat it very aggressively.
Thank you so much, sir. Thank you, one and all. Let me take this opportunity to thank each of the panelists. I'm for sure your insights would be of help to many of the participants. I thank all the participants, and I hope this was an informative session for all of you. Stay healthy and stay safe. Thank you.
Thank you.
Thank you. Thank you so much.
Thank you.